This is my passion, and I'm here to have a conversation.
Thank you. Dr. Emanuela.
Okay, I'm Emanuela Mobi. I'm a pediatrician at Pelham Memorial Hospital. So basically, I deal with children.
Thank
24 hours.
you. Dr. Bonjour.
All right, my name is Bola Abiri, and I'm a consultant psychiatrist, a mental health advocate, and a lecturer. I do a lot of work around mental health in the general population, but also for women and children, and a lot of occupational mental health. I also do a lot of content creation for mental health awareness and advocacy, and I'm happy to be here. Thank you.
Thank you all so much. As well, sorry, if the audience has any questions, please do send them into the chat. I'll be able to see them right here. And towards the end of the discussion, we will get into questions from the audience. Thank you all so much again for being here. Let's start off with the factors that contribute to depression in kids and teenagers. Dr. Bonjour, let me come to you first.
Okay, well, thank you very much. I think that question is pertinent in the light of the fact that whenever we talk about mental health disorders, there's something we say about it being no respect of anyone. And so mental illnesses or mental health disorders can happen in people, regardless of age, gender, socioeconomic status, race, or even religion. And so children are not left behind, unfortunately. And so when you look at what some of the factors that may be contributory to mental health disorders in children, usually when you look at causation of mental illnesses, we usually look at it in the light of biological, psychological, and social. Biological, either because there's a genetic predisposition, meaning a family member already has depression or is predisposed to having depression in the family. It can be the fact that a child may have a physical health condition. So imagine if the child has perhaps diabetes, the child has a physical condition like nystagmus. I spoke to a patient last week and she told me that because she had nystagmus, it took a toll on her self-esteem and then her mental health. So that's biological or physical. Then of course you then look at psychological and social, which I would group together. Psychological usually has to do with exposure to significant traumatic life events that people go through. Life events like physical abuse, sexual abuse, emotional abuse, neglect in children. I mean, we must have caught the story of the little child that had his arm amputated last year, who eventually unfortunately died. If that child had made it to childhood and he had a deformity, his siblings, friends, people in the environment would have made fun of him because they are not sensitive to that fact. So that's a psychological issue that causes stress, trauma in the environment, family trauma, dysfunctional families, homes where there's violence, homes where there's domestic abuse. Then of course, self-esteem issues, the children not feeling well catered to, children not feeling like they are loved or they are wanted. And some of these children are told some of these harsh realities by their parents. I like to talk about the concept of what is called emotional inheritance, about how it is that many parents have unfortunately gone through trauma, haven't healed from their own trauma, and keep handing down their trauma to their own children. That also predisposes them. And then last but not least, let's talk about social issues. Illnesses, ignorance in the environment, financial instability, insecurity. These are some of the factors that would predispose children to conditions such as depression.
Thanks, Dr. Bonjour. So here we're looking at the psychological and we're looking at the social. And I think that's a very important point as well on parents also passing down trauma to children when parents haven't actually healed from that trauma. Dr. Emanuela, let me come to you because you see children every single day, and we need to also look at the signs and symptoms, the early signs and symptoms of depression in children.
Okay, thank you very much for that question. So, wellness has to know, because most times you tend to think that it's just a physical thing. We forget the mental thing. So a mother brings a child to the hospital and she goes like, I'm doing everything, my child is feeding, but she's not gaining weight. So they call me up in school and they say that my child is inattentive in school. Okay, so all of a sudden she's suddenly withdrawn, she doesn't want to play with her friends. Or most of the common symptoms that I get is she's having this abdominal discomfort, it never goes away. We're taking antacids, we've done Buscopan, we've done ultrasound scan. In fact, she's even had MRI, of course, now we have sophisticated investigations and, most people always are quick to do that. So sometimes these symptoms are they are not physical. Okay, so they are physical symptoms, but the etiology, the pathology of it is actually the mental health problem. So when they come like that, first of all, of course, you have to properly examine the child and ascertain that really there is no physical ailments, because there are some common things that can cause these symptoms and signs, like if a child has an infection, if there's a tumor in the brain, it can actually cause a personality change, So when you've done that and you've ascertained that, of course, having done your lab works, your blood works, your radiological investigations, and you've ascertained that there's no physical problem, then it's now time to dig deeper, So most of the time, if it's a child that is a bit older, like from 7, 8, most of the time you ask the parents to excuse you, and then you get one-on-one with the child. What is the problem? Are you being bullied in school? Just to get out the trigger. So commonly, that is what we get. So the children can have what we call like organic signs. So abdominal discomfort, headaches, fatigues, or the mother will complain to you that the child is not gaining weight, the child is socially withdrawn, the child lacks energy. So my child loves to play football, but all of a sudden, he says his legs are paining him. He can't even bring up the legs, and then you examine. There's absolutely nothing wrong with that, so. Those are the common. So when you get a child like that, you just have to go the extra mile. Yeah. So when you talk to the child and find out, and somehow it's a good thing that most children trust their pediatricians. So you talk to the child and then we decide, okay, so at this stage, what do you let mommy, what do you let daddy in? So that the child, you gain the confidence and the child is comfortable, so that you can be able to help the child. Yes, so at this point, when we get the symptoms, then we now look for to help us. Of course, it's always a teamwork. It's always a teamwork, because it's not an isolated problem. So we take it further when we get to that stage. So usually those are the usual signs that we get.
Thanks, Doctor. I guess it's also so important for parents to know that their children have to have one-on-one relationships as well with their doctors, whether that's doctors for your physical health, your mental health, in order for that child to get the best care possible that they need. Lale, let me come to you, and I'd like to take it back to the factors. You're a wellness coach. You see a lot of young people today in these positions, living with depression, etc. What are the contributing factors that you often come across for young people living in depression today?
There are a number of contributing factors that in most cases are not really in what we call the young people's hands. It's something that kind of transcends over generations into their hands. Something I can mention, off the top of my head, in this generation that we're currently in, and possibly in most generations as of quite recent, is a sense of powerlessness. Is this sense of powerlessness where we live in a very active world where it's very innovative and it's constantly being progressive. Things are developing, going on and on. And things are faster and more dynamic than they have ever been before. Yeah. And yet somehow, and I think a lot of people, I don't want to make this anything racial or gender specific, but a lot of young Black people might realize that, when you go in the world, you have this intelligence, you have this ability and capability, but you engage with the world and there's just this denial whereby you can't necessarily get what you deserve and you're powerless to do anything about it. And then you often wonder why. It can play out as early as when you're young and you're trying to get the friends that you really want to have, or even kind of get the reciprocate the respect that you think you deserve, or to a certain degree, the love that you think you deserve as well. And you're just denied that. And of course, at a young age, you're very inexperienced to be able to articulate exactly what the problem is. Why am I incapable of receiving this, and you have to come to a conclusion very early. So what you do is you just decide, I'm not good enough, or maybe it's me, I'm the problem, I have the issue. And if we really dig a bit deeper or look a bit deeper into the matter, it probably isn't you. It's probably a system that you were involved in that is defunct, broken, or archaic out of this, or even in some cases, possibly corrupt. It's what word do I use now? It's a timeline. It's something that was passed down to you by maybe the generation before didn't fix a problem. And like she was saying, Mrs. Emanuela, they didn't fix the problem, and it comes down to you, and you have to try at that young age to fix it, which is very difficult to do. And of course, I believe in the Bible. I believe that if you're not equipped with people around you who are able to help you, then like I strongly believe in family. And we are graced and blessed in Africa to actually have good family, because families protect us, and they're the ones who basically, when they see us faltering, even in a situation where there's so many people against you, your family is going to be the one that basically will have your back constantly. Like they'll constantly tell you to keep the faith. And that in itself is linking it to the Bible, is sowing the seed today that possibly could germinate tomorrow and help you see a bit clearer into the situation. I often tell the people that I work with, clients I work with, that if you have a memory that is longer than, let's say, 5 years, like something happened 5 years ago, and it's constantly still in your mind, then there's a problem. Because a lot of people think our memories are actually used to actually recall things of the past. No, memories are actually specifically designed, well, not designed, but it's what we truly use it for is to ensure that the problems that we are going into are not the problems that we come from, that we solve the problems of the past, and that now we are upgraded to a point that we can move forward to new problems. We're not afraid to move into a new environment because our previous problems have totally been solved. So there are a lot of people who are afraid of heights or afraid to go outside, agoraphobia or certain phobias they have, and it sticks with them for many years until they're capable of actually facing that fear and encountering it. And I'll speak more about this later if it comes up, but it's actually the idea that can you actually fly if you don't take a leap of faith? If you don't walk to the edge and actually take a leap of faith, will you actually be able to end up flying, or are you going to stay in the nest forever? So I do encourage a lot of young people to, the memories they have, first of all, to deal with it, not to discard it or bury it deep, but to deal with it and speak about it, and speak clearly about it, and face their fear on that matter. Because I do think a lot of young people feel powerless deep down inside.
That's a very important point, because when you try and get to the crux of a matter, a lot of the time you find that these are the issues. My sister-in-law and I were speaking about this the other day, that importance of nuclear and family and having a close-knit units to get through issues in life. Dr. Bonju, what's your reaction to what Lawale just said? Because I'm sure you deal with very similar.
Yeah, so thank you, Lawale, for sharing deep insights.
Thank you.
When you talk about powerlessness, my mind went to a psychological concept that is known as learned helplessness. Learned helplessness was developed by a psychologist by the name Martin Seligman. And the simple thing that he did was that he got a cage and he put dogs in the cage and he electrified the cage. And so every time the dogs tried to escape, whenever they touched the cage, they were, electrocuted. But after a while, the power was turned off. But because the dogs had tried and tried and tried, after a while they felt, there was no need to keep trying anymore. Every human being has a need to be wanted. You want to be validated. You want to be seen, to be heard, to be loved. And until we understand the development of children and adolescents, which will take me back to another psychologist by the name Erik Erikson. I mean, I look at Erik Erikson many times because Erik Erikson looked at the interplay between the mind and the environment, the psychosocial developments. And what Erik Erikson did was that he looked at everyone from age 0 to when we go to the great beyond. And at different times of different individual lives, there are certain things that they're achieving. And so, for instance, between the ages of 0 and 18 months, you're achieving what is known as trust versus mistrust. At that age, the child is born into a world where he's helpless. He has to rely on other people to be fed, to be clothed, to be kept warm. If the child has consistency in all of those things, when I cry, someone holds me. When I'm hungry, someone feeds me. When I'm, down, the child is likely to feel, a sense of trust in the environment. But if the child doesn't get that, that's, where the foundations of the problems start. The next phase is what is known as the autonomy versus shame. And so when you see little children at about, age 18 to 36 months, and you say, you're bottling up for them, say, Mom, no, I want to be by myself. I want to be by myself. If we allow them and consciously guide them and show them what it is to do, those kind of children are more likely to become confident, autonomous, take decisions. However, if you keep telling them, you don't know what you're doing, you won't be able to do it, and they have a sense of shame, a sense of self-doubt that, I can't do it, I can't. And again, this is where the foundations are laid. The next phase is what is known as initiative versus guilt. Yes, initiative. Children start to take initiative. They take brooms around the house. Mommy, I want to help you sweep. Mommy, I want to do this. Sometimes, if they are validated, carefully, shown how to do things, even if you don't feel like they're right, they have a sense of responsibility. So at every phase, you're seeing something develop. The next phase after that is industry versus inferiority. And that goes about, to the age of 7, 8, where children start to come up with ideas. A child can come up with this and say, Mom, see, look at the Eiffel Tower. And even if it looks nothing like the Eiffel Tower, the fact that this child could, come up with an idea, knows what the Eiffel Tower is, you say, wow, I'm so proud of you. This is so beautiful. But many other parents, don't have time. They put the child down. They say, how does this look like the Eiffel Tower? Your other mates are doing this, they're doing this. And that phase is important because that's where self-esteem is formed. If a child is constantly put down, especially again by the nuclear family, where there's supposed to be a lot of love, a lot of support, a lot of awareness, a lot of, self-concept, as in understanding yourself, then the child thinks that, well, if I can't get it from home, if nobody thinks that I am great enough, then perhaps I am not. Perhaps there's nothing to, and it is at that phase that children then start looking at, like, what Lawali said. Who are my friends? Who are the people that validate me? Nobody's listening to me at home. That's when they ask a million and one questions. And if you're not answering, they go to the people that can give them answers. Then of course, adolescence. And the phase of adolescence is one of the most tumultuous. I mean, we're all adolescents, so we know. Every time I talk about adolescence, I remember one day when my mom was going to do something, she had dressed me up or had me dress myself up. I tucked in, was wearing a skirt, and I thought I didn't like it.
Yeah.
And so when I got out of the gate, I just pulled out. Unfortunately, by the time I was coming back, I forgot to tell you. And so you can imagine what happened at that time. Around that time too, in my life, I had a crush, which a lot of parents don't seem to understand in this age and time. A child said to me, I told my mom I had a crush, and she said, I bind the devil in your life. Seriously. When I had a crush, of course, I did something silly. I wrote a letter, put it in my underwear, and my dad saw the letter, and I got beaten. But when my daughter had a crush, I just went into the room and I saw her writing the letter, and she kept, hiding it. And, even I had to speak to another psychologist to say that what's the best way to go around this? Let her know that it's not wrong to write a letter. It's not wrong to admire someone, but there's certain things were looking out for you in your life around this point in time. So that's very important because at the end of adolescence, children are trying to experiment. Children are looking at, am I with the cool kids or am I with the nerdish kids? There's a lot going on. There's a lot going on physically. There's changes in the body. You have breasts growing out. You have pimples. You see a lot of adolescents these days. They're wearing sweaters, wearing clothes. What we don't know is that a lot of them are self-harming. They're putting themselves. There's a problem with body image. I mean, it's extremely important that we talk about social media. I don't know if but yeah, we'll talk about it. And so there's a comparison between what reality is and what expectations are far, that's causing a lot of distress. I like that Lawali talked about the family, and I like that you try to reinforce it. But believe me, Africa and Africans are losing the essence of what family is. And so, because we're trying to be like the Western people, because we're losing that sense of community. I used to live in an estate where, and I'll say, yes, every Sunday morning will come up with their kids, father, mother, children, you know, all those things we used to do, they will form a big circle, they will play water games. We keep saying that we're the closest mates. I don't see it anymore. We're losing it. Because again, we're about the comparison game. Everybody wants to say, oh, my family is doing well at the expense of, we're losing it. And unfortunately, a lot of this will contribute to depression and many other mental health problems.
Thank you so much, Dr. Bonju, because it's so important that we understand the different stages and what children go through at different ages. You know, even years ago, having conversations with my friends, we would always say how our adolescent years, our teen years were the hardest years ever, because so much is changing around you in your body, so much is changing in terms of your social life, the things that you do, and you're trying so hard to fit into everything and navigate around that. And without that support from your nuclear, it becomes so much harder. So affirmation, making sure that one's self-esteem is always propped up to ensure that that person is well equipped within who they are to go through life. You brought up social media, and I think it's so important that we speak about this. And I'm going to now throw it open so anyone is free to answer. How do we deal with this issue? Because it is affecting every young person today, even young people who try and overlook it and say, you know what, I'm not going to let social media morph the way I think or distort my thoughts. It still manages to creep in somewhere and somehow. How do we deal with this, everyone?
Well, what I think is that in regards to social media is a new innovation. It's brand new. When I say new, forgive me, obviously it's not new to the people who are watching, the youngsters, but I mean, in the scheme of things, like when I was coming up as a youngster, there wasn't social media. Pre-social media, I remember those times. I remember what it was. I mean, we had video games and we had television, but we also had this ability to kind of come together and speak face to face to each other. We were able to communicate, we were able to form teams. I remember when we were young, we used to play this football game, score and keep, monkey post, play football on the streets. And those times, bonds were made, friendships were tied together.
Good morning.
Where you might have a grandmother in.
I'm here alone.
Okay.
I'm here alone.
And basically, all you need to do to greet her is.
I'm working with my
There's some people long time ago that to be able to see their grandmother, they literally have to journey.
Christiana, mute yourself, please.
How social media has really affected and has brought is there's this sense of and I don't want to be too critical. I'll try to be as realistic as I possibly can and be as straightforward, is that we just frankly aren't as tough. You know, our kids are not as tough as our parents and the ones before that. We aren't designed the same. We weren't built the same. And what I mean by that is that there is a fragility within us, whether we admit it or not. I don't know how many people are willing to admit that if there's no internet in a day, that it could literally ruin their whole day and make them as uncomfortable as ever. And I know some developed countries, if they don't have electricity in a day, or some people, if they don't have a toaster in a day, it's going to shut down their whole day. If they don't have a coffee machine. And it's the dependency, it's kind of like a crutch now. There's certain parts, someone once said it, that we might be upgrading in technological skills, but there's a downgrade in social skills, mental skills, psychological skills as well. So major downgrade. I used to have a grandfather who used to speak Latin. Like when he studied and went to school, he could speak Latin. How many people can speak their language? So what I think is that basically what we actually are dealing with in our generation is a vulnerability and a fragility that we are not actually paying close attention to. And it's playing itself out in different forms. We think that we are building relationships, but they're missing elements of those relationships. You know, there are the trust issues. What I perceive in a lot of people that I talk to and work with is we can talk the talk, but the trust, the binding, the connection, the linking is absent at the end of the day. And I think that in time, if we don't actually pay attention, or if we don't actually ground ourselves to be able to, you know, as we move forward, also to hold on to some values and some grounding characteristics of the path, characteristics, that's what I want to say, of the past, then we might actually, you know, find ourselves in a loophole. But actually, that's what I try to do with young people is when I engage with them, I engage with them with the realistic of a world sans technology. People who come to stay with us in our place, one of the first one of the first things we do is we tell them that, look, if you're staying with us, you're going to have to give up your phone. And that's the first comeback, because that's that cognitive I can't exist without it.
It's not normally point. It is the condition.
Dayo Mohammed, please mute yourself. Dayo Mohammed, please mute yourself.
Thank you. Please stay muted.
It's always within the first 2 days, what they find is that they can exist. And what really is encouraging is how much they build up this self-discipline to say, hey, you know what? No matter what, don't give it back to me. Don't give me back my phone. If I do, I'm worried that I might slip back into old habits. I might fall back into old patterns. I want to develop myself literally from the ground up. And then it's basically this story that it's going to come. It's denial of gratification, self-gratification. It's going to come, but I would like to earn it. I'd like to know when I have it that I earned it. And, you know, that's my perception. I think we are a little bit weaker than we were before, but I think there's still the ability to continually try to progress, but also start from the bottom and build upwards.
Thank you. Thank you. And I think that's so important, because also now looking at the roles that different people have to play in helping young people and children. Dr. Emanuela, the role of schools, the role of parents, what advice do you have?
So I totally agree with him. You know, as he said, we're a little bit weaker than we were, and I mean, that's the sad truth. Unfortunately, in trying to copy the Western culture, we failed to put like a stop. How far do you go? You know, because the truth is, we were not raised this way. You know, we were raised in a world where you come back from school, you play, you have family time, you know, you have real conversations with your parents. But our reality is that the world has moved on. So it's all about finding a balance, right? When my children were much younger, you know, I'm of the old, I may be young, but I'm actually of the old school. So I was of this opinion that no phones, no gadgets, no, you know. But after a while, in fact, it was actually their grandma that bought the first device for them, because she was like, no, all the children have this. You can't just deny them, you know, they have to be able to, you know, communicate and socialize with their friends. And at that point, I said to my husband, you know what? I don't think we can actually avoid, you know, when you have children, you want so much to protect them, you know, but the truth is they can't go back into your belly, and it's only when they are there that you're actually in full control. So we just have to strive to find that balance. And I said to him, see, they are going to have these things, but what it means is that we have to up our parenting game. You know, you have to know, you just have to be in their lives. You just have to be. So I think I feel so much that as parents, we're doing like 1/4 of what we're supposed to be doing. Because these young ones, they don't have a choice. I was talking with a friend the other day, she was like, Manuela, you keep trying to go back to the world where you were raised. But the truth is that the world we're raised in doesn't even exist anymore. And I thought about it, I was like, that is actually the truth. It actually doesn't exist anymore. So it's all about educating parents. So as parents, you have to equip yourself. You have to, someone said be a parent, don't be your child's friend. I don't believe in that. It's about, you have to be his friend and you also have to be a parent. It's just that you should know when to switch roles. You can't afford to just leave the child to just go on like that endlessly on his own. You have to have the conversations to be able to, filter what he goes into. And these children, they are so techy. They move into this, they say, use this to track the phone, use this to track the site they enter, they bypass all that. So it's like, you just have to be in their life. So I think that a great part of tackling the main issue we have now is getting the parents to understand that, like I always say, new doesn't always mean better. Be a parent. Talk to your children, be in their lives. See who are they talking to, which sites are they visiting, what do they think about themselves? What Dr. Bonju said earlier is very important. We have to do a lot of talking, building their self-confidence. When my children were still much younger, I have 3 sons. So the younger 2, they are much older. My first is not that old. But you see what I did with this boy. Like now in fact, his confidence is now a problem for us because he comes into this room, he just feels it's now a problem. So, but what did I do? So we go into the crowd and I'm like, I gotta go to the front there and pick up the symbol. And it's like, no, mommy, I gotta say, no, you can do it. See, mommy and daddy are here, we'll watch, and you don't even know who you are. Do you know the son of who? We literally built him up. And now it's gotten up to that point where there's nothing. Like, I feel I'm okay to send him anywhere because I know that I have equipped this one. But it was a great work I had to do because, children were all born with certain natural characteristics, I would call it. But some of them we have to learn. So, but just think about it. If he was born in a home where no one helped him, by now he will probably be he'll probably be one of your boys if we could afford it. So I think that parents we just have to take up the mantle. We just have to take up the mantle and be parents again. We have to be more watchful because we have more problems in our hands. We have to talk to these children. Unfortunately, Lagos is by the time you go into traffic, you're tired. But like you said, you don't have to travel to visit your grandma. You can pick up the phone and call. So nothing stops you from having a conversation with the child while the driver is taking them back from school to the house. Nothing stops you from talking to you don't necessarily have to be physically present to talk. You can make use of what is the available resources that you have. And then the little time you have, actually sit down and have a conversation. I had this, my first son, in fact, he's really a great deal. He has taught me a great deal in parenting. There was a time we had issues with him and his phone. He was always on the phone. I'm like, see, you cannot have virtual friends. They are not your friends. You don't even know them. They don't know you. You have to form physical bonds. You have to have real relationships. And it was always a cause for concern. In fact, at a point, do you know what he did? He actually got the phone. I said, Mom, please, can you keep this phone for me? Each time there's a family call, it's all about this phone. Just keep it. I've actually thought about it. I'm not sure I'm able to handle it. I'm not sure I'm able to do what you actually want me to do. So just keep it. Later on, I was like, wow. For him, it was such a big deal. And he kept that and he started having real, and now he realizes that, okay, so I can actually exist without this. But we have to help them. Because, like she said, it's helplessness. Their children are helpless. That's why we have to be advocates in any way we can.
So you need a lot of awareness.
So we need to create a lot of awareness,
Oh,
because the sad part is that some of the parents are also treading this path. And that is very bad. I don't like to think about it because for my mental health, what I don't have a solution with, some maybe, I'm not sure it's a good thing, but I just tend to avoid it. Because where a mother is in the house and she's just on the phone, she doesn't even know where her youngsters are. I just don't want to think about it because I don't know how to deal with that yet.
Thanks, Doctor. No, awareness is so important. And one other question I have, Dr. Roger, I want to come to you with this. What's the difference in treating depression in children as compared to treating depression in adults?
All right, thank you, Leila. I'd like to jump on that
Please
conversation
do,
for
yes.
us. And there are 3 pertinent things I want to bring up. Social media is the drug of the future, and the future is already here. And so you see all of these things that we're talking about, that in those days, you're talking about you come back from school and you play. In those days, there was no light at 4 o'clock. TV stations did not start till 4. I tell my children, I think there were times that for 3 months we would not have electricity, and we didn't have a generator growing up. Imagine coming home to that kind of reality. And so you see children these days, never takes lights or there's a power cut for like 10 minutes and you hear, Mommy, I'm bored. Exactly. And so what we're beginning to see is that social media is actually a drug. It's a drug because whatever it is that children see or adults see excites them and leads to a release of excitatory neurotransmitters, such that when it is taken away, you start to have withdrawal symptoms. I need something else to replace this. If we're all at that point, we need to, take it easy. The second thing I want to, talk about is how it is that unconsciously we're beginning to raise autistic children, and autistic, not born autistic, but children that you're equipping with devices. Yorubas call it bajensi, take, let me rest, so that I can go and do something else. But unfortunately, when you leave the TV to mind your children, you leave a tab to mind your children, you leave a phone to mind your children, you leave them to the world of the internet. So unfortunately, a lot of children are coming down with, issues like even child pornography. They're going into sites they're not supposed to. I mean, I relish the times as children. We planted corn, we planted yam, we would run around the compound. I had a dog that I used to put in water and watch, swim. We used to do a lot of stuff. We had friends in the environment. We used to ride bicycles. All of that is almost gone. I mean, look at the houses that we build nowadays. There's even no play area. There's no grass. The last thing that I want to talk about is how it is that, yes, children nowadays and even some adults are emotionally fragile and there's no resilience. And so you see that toughness, that grit, that being able to cope with whatever it was that life brought your way many times in those days is no longer there. Yes, the times are changing, and parents, like you said, there's a call to parents to become a clear, conscious, and deliberate about what parenting is, and to say that I will put in the work. Because once you take a decision to have a child, it is a decision, it's a lifelong journey, it's work. It's work that you need to put a lot of energy into. So I think that, if we understand the times that we're in, we also understand the kinds of children. 21st century parenting, it's not like what our parents did for us in those days. And so depression in children and adolescents and adults, there's a clear distinction in the sense that the symptoms that you see in children are not, necessarily the symptoms that you see in adults. And so if I wanted to reel out what the books would say, according to what the diagnosis of depression is, you talk about the 3 core symptoms: mood, energy, interest, all low. Additional symptoms, biological symptoms: poor appetite, poor sleep, low libido, feelings of hopelessness, feelings of worthlessness, suicidal ideation, sometimes suicidal attempts, feelings of guilt, feelings of hopelessness, worthlessness, and helplessness. Undue irritability, you're likely to see that in an adult, or at least you're likely to have an adult tell you that this is how exactly it is that I feel. But in addition to what she said earlier, is the fact that children are unlikely to verbalize to you that this is how I'm feeling. And so you would, if you have a high index of suspicion, which is where it goes to the fact that as a parent, you must know your child. The role of the school, as teachers who are interested, a teacher will know that this is the normal thing, or this is what is usually, anticipated and seen in this child. And so you see things like grades falling. A child who was doing so well before, who could, walk into a room and own the room, suddenly becomes a recluse and wants to stay in a corner. sometimes you notice that a child who has achieved a certain milestone, such as daytime and nighttime bedwetting, just suddenly regrets it, and it's bedwetting. You have children who are acting out in the sense that they start to engage in behavior that ordinarily is not expected of them. So, you see Layla as a child, she's very respectful, she sits down, but no, she wants to talk back, those changes may be seen as subtle. Sometimes you can even see a child just break down crying for no reason. You're asking, what's going on? What's wrong? Some children actually verbalize. They say, I'm not happy, and this is how I'm feeling. And some children actually say that I am tired of life. I don't want to be here anymore. What we've started to hear a lot in the media is that children actually take their own lives. So suicides, they don't, they're not even talking about it. They just go ahead and end their lives. I mean, all you have to do is go on the internet and perhaps get the information that you need. And in some, you just see them cutting themselves. Some, engage in harmful behavior. I mean, for people in, the substance abuse space, you find that the age of initiation of use of substance has dropped from what we used to know as maybe 12, 13 to 7, 8. You have children experimenting, trying to, do all sorts of things. For some children, it's wanting to spend all the time in the world in front of a TV or a device, just to push out everyone from the world. And so the treatment for that in children, because they're children and because their doctor is here, is usually a multidisciplinary approach, which, has the head of the team being a pediatrician that will be aided by a psychiatrist, because you can't treat children like you treat adults. For adults, of course, someone like me, I like to wait. I like to understand and weigh what the options are. If there's a red flag, such as suicidal ideation, we'll start medication. We'll maybe look at admitting you. However, for children, there's usually that combination and more of an emphasis on behavioral intervention as compared with medication. And so that behavioral intervention would include, talk therapy, social interventions. For instance, you must be interested enough to go into the home to find out what is happening. Is it the driver that is, having an effect on the child? Is it the house help that, is influencing or introducing the children? Is it bullying at school? Is it name calling? Is it the parents that are constantly fighting? All of those things have to be addressed before you even start, talking about, will this child benefit from medication? However, more often than not, for children, the care is multidisciplinary, it is individualized and customized to fit their needs. But more emphasis is on behavioral interventions as compared with the use of medication. When medication becomes necessary, it will be, recommended.
Thanks, Doctor. That's very interesting to know. And it's shocking, but not surprising to hear that substance abuse cases are now starting from as early as 7, 8 years old. How does one tackle this? You're in that space, Doctor, I'm sure as well. You have patients that you've been worried about with regards to this. How do we start to navigate around solving this issue?
Well, a lot of children, in regards to substance abuse, it's really multifaceted in a number of ways. The generation that we are in now is, one where there are a lot of underlying problems. However, I also like to focus a lot on the problems that really have nothing to do with the children. Forgive me, I can't speak in very professional terms. Esteemed professionals here, but I really look at it as sometimes some of these problems are hereditary. There's some children, especially in regards to alcohol, there's something called SOAM, sons of alcoholic mothers or sons of alcoholic fathers as well, 5 times more likely to become alcoholics or, even possibly suffer from a form of personality disorder, antisocial personality disorder, which in itself could possibly lead to, if unchecked, can lead to some form of addiction in the future, because there is a huge likelihood that first of all, that restlessness could be seen as some kind of behavioral problem. They might have a lot of issues being able to sit still in class. So what might happen is as early as a young age, or maybe about between 8 and 15 years old, they can be put on some form of medication as early as that. And in some cases, they might try to self-medicate themselves if they find that this antisocial, if this personality disorder is refraining them from making friends or having proper relationships. And then that could even spiral into a form of depression in itself. These people sometimes find themselves ostracized from society. So it's definitely a difficult thing for a lot of people to deal with. Young kids, and it's fact that it's more likely to appear in males than it is in females. In that early stage, what you often find is that they, go through a life where they might experience a deep sense of trauma, through their interactions with both society, systematic institutions as well. They might be traumatized to a certain degree. And what ends up happening is experiences that, either push them to extremities, or causes them to, like Mrs. Dr. Odibola said, Dr. Emanuela said, to become reclusive and to dial it back a little bit. So for young children, as early as that, what I definitely would recommend therapists, who can work and of course, for parents and families to become a little bit more educated on mental health and on the effects of substance use. And for people, someone mentioned the idea of the word responsibility, that intonation of taking responsibility, and also not to be afraid of their children. A lot of people actually see their children acting out, as Dr. Emanuela said, and not to become afraid of them, but to put them in the right spaces where they can guide them to solutions. I strongly believe in the principles that, I hope I'm speaking loud enough, but teach your child in the way they should go. And, I'm not the best Bible, but, I'm not the best preacher out there, but they will follow through. This is what they will learn. This is what they will stand upon in the future eventually, when it happens. And of course, I strongly believe in giving them space and room to be able to talk, to be able to express themselves, what is happening inside, for them to be able to speak. I find with a lot of, especially young men that I work with, that they haven't really had the opportunity to truly articulate what they really feel. They don't really speak about it. And if they try to speak about it, they can't articulate it. And what I encourage young men to do, and I know this is much older, but most of the trauma occurs at a young age. And I encourage them to write, because when you are able to write things down, and when you read a lot as well, you literally begin to know what, first of all, when you read, you learn a lot of words, and then you kind of, you program your mind to be able to sit and use and put words in their proper places. And then if you really are a good thinker, you can use the right words to actually in the right places. But how do you do that? Well, if you write often as nearly almost every day, what happens is you teach yourself to be able to design your own mind. You actually can know exactly what you are thinking, and then you can actually experiment by putting proper words right next to each other just to express yourself on page. And then you find communication a lot more fluid and easy. And I think that communication is actually one of the most important skill sets moving into the future, the ability to communicate who you are, what you want, and why you want. And so I really do have a lot of hope for the youngsters, because I think we're a generation that has become very aware, very educated about what currently is going on in regards to mental health and, that space in particular. And once we concentrate on it, there will be solutions. There will be solutions.
Certainly. I mean, I think that's so important, looking at how you can design your own life, your own thoughts, and being in control of that. In just a moment, we're going to open up to questions from the audience. So if you have any questions, please do send them in. But before we do, let's touch on stigmas to round this up. Let's speak about stigmas, because I often feel hope, because I feel as though stigmas are not as much as they used to be towards mental health and mental health care. However, these stigmas still really, really exist, especially here in Nigeria. How do we navigate around the stigmas that exist in the mental health space that unfortunately is stopping a lot of children and teenagers from getting the help that they need?
Okay. So if I wanted to look at stigma, I would look at stigma as a tree with branches, and how it is that whenever we try to skirt around the issue of stigma, it's like cutting off the leaves and hoping that everything will go away. However, give the tree time, it will grow back again. The stigma that people felt with HIV as compared with that which is felt with, mental health disorders, it's not very comparable. As in, you see people walk into, HIV clinics, oh, I'm here for my meds, so I'm here for my CD4 count. With mental health, it's much more difficult, largely because we have issues ingrained from and passed on from generation to generation to generation. At the root of that tree of stigma is beliefs, thought patterns, myths and misconceptions, ignorance that people have had, handed over from time. And so if we want to effectively deal with the stigma, we need to uproot that tree and start to question and confront all of those beliefs that we've held for so long. Mental health issues are in some homes not spoken about.
Yeah.
I was reading something last week and the guy said, oh, on their family WhatsApp page, he just said, oh, this thing is depressing. And one auntie said, reject that.
Nobody will be depressed in Jesus' name.
Exactly. And while there's nothing wrong with confessing your faith and speaking, the word, it's also very important that we start becoming realistic about issues that are here, issues that if we don't confront, they can become bigger monsters. And so, stigma can be what is known as self-stigma. Stigma that the individual has towards themselves, that the environment has not even said anything about. And then there's, of course, environmental stigma. Confronting stigma I like to always say this, that we need to start changing the conversation to change the culture. We need to change the way we look at mental health issues. I talk about mental health with pride. Whether or not I have a mental health issue is another conversation. But quite a number of times when people see people come out on social media or want to talk about mental health, they say, you must be seeing a doctor somewhere. That's why, that's the only reason why you can be so passionate. If you have, a philanthropist today say he wants to put his money in mental health, people are more likely to say that, oh, it's because they have a family member who is dealing with. And even if it is so, there's nothing wrong with, individuals trying to give the best to a cause that they believe in. And so each and every one of us has to change language. The language of, saying things like, oh, it's Kolo mental, it's coin, it's Java left, it's arrow. All of those things, yes, they make people laugh, but these are individuals' reality. These are, people's lives. To many of us, it might look like, oh, it's just another mentally ill person on the street or another mentally ill woman, but this is somebody's son, this is somebody's husband, somebody's brother, somebody's, mentor. And so we need to start giving it, the attention that it deserves. A lot of awareness and advocacy. So of course, I should compliment and continuously do so, a thing like this that looks at encouraging people to be aware. Information, awareness, advocacy, but for each and every one of us who is here and who is listening to also determine that, today henceforth, I want to be an advocate for mental health. Again, because mental health issues are no respecter of anyone. There's a quote that I like by, a professor of psychiatry, Vikram Patel, and he says that mental health is so important to be left to the professionals alone. So the work that I do, we're just talking before we started. In Nigeria at present, there are less than 200 psychiatrists to a population of over 200 million people. That means 1 to 1 million. You can then imagine what it is with psychologists, social workers, occupational therapists, And that number is further shrinking every day because of SAPA and JAPA. And so everyone needs to understand that it is my responsibility as much as it is yours. While you may not look like it's in your home today, you may, and a lot of people don't even like to talk about it. And so we need to start talking about issues. I remember one day I was sitting with my daughter, I was driving rather, and 2 days earlier I lost a friend from university. And when I was driving, she said, "Mom," I said, "Yes." She said, "Don't you need a grief therapist?" I said, "Why do you say so?" I said, "So where did you get that idea from?" She said, "I was reading the Diary of a Wimpy Kid, and that in one of the books, they talked about children, getting support for grief, if there's grief within the family." And I'm like, wow, even the, books that you give them, the internet is, replete with resources. We need to start changing that conversation. And, even as I'm saying this, I'm also challenging myself because there's so much so much to do more. We need to start early, inform children early, let them know early, start the conversation early, and start to change the mindset of people who have often thought that, mental health issues it's not my portion. It's not, just because it's not there today, again, like I said, does not mean that it cannot show up. And so let's learn about mental health. Let's look out for others. Let's listen to people who are struggling. And most importantly, let's link them with sources of support.
Thank you so much, Dr. We have some questions coming in. Sorry as well to everyone that's on this virtual call with us. If you sent in questions earlier on, please can you resend them to the chat? They seem to have gone missing, so please just resend them over. But we do have one anonymous question that's come in. Someone has asked to remain anonymous. My bubbly and almost hyperactive 6-year-old son has recently become a little more reserved and quiet. I feel it's too early to attribute this change to maturity. Should I be concerned, and what can I do to fix this?
Well, to address that question, thank you, Anthony, for the question. So first of all, like I said, in children, we have to be careful because so the human being is made up of the physical parts, the mental parts, you have the body, mind, and soul. So before of course, you should be, the first answer is that yes, you should be concerned because, like I said, as parents, we have to be observant. We have to, because children, they don't give you clear-cut signs. They are just subtle changes. So if there's a change in your child behavior, yes, you should be concerned. I think the first step is to bring the child in to see a pediatrician to get properly checked. Your child that has become quiet, so is it that it can even be something that's, well, let me not say minor, but something like an ear infection, but the child cannot, articulate it properly. All he knows is, he can't even localize it to the ear. He just knows it's like there's something drawing my head, there's something drawing, so children are like that. So first of all, the child needs to be checked, properly examined to ascertain if there is a physical ailment. So if there is one, it will get treated. Like I said earlier on, before we go into the psychological part of ailments, we have to take out that part first. So I think that is the first step. Of course, when we've checked all that and then everything is fine, we are sure that there's nothing wrong with the child physically, then we'll now move on further to the psychological part. A lot of times, people, when you tell someone, "Oh, I think you need a psychiatrist," I say, no, I'm not mad. I'm not a mad person. But like you said earlier on, we need to be doing a lot of talking. Children need to talk. They need to express themselves. There are a lot of, even as adults, how it is when you have something big on your mind, you literally, you're having a chest pain.
Yes.
You understand? But by the time you've talked about it, you're like, oh, I feel much better. What just happened? You only just thought. But we tend to assume that children are not, just the fact that they're children, the fact that we're able to put them in one space, tuck them away, we feel that they don't have such, they feel all that, So first of all, we need to see your child and examine and be sure that everything is fine. If everything is fine, then we'll move on further. Of course, there is nothing, thank God that we have a lot of resources now. I almost like to think that there's nothing we can't tackle. I mean, we actually have a lot of resources now. So yes, that's the answer to that question. You should be concerned and you should get help as soon as possible.
Thanks, Dawn. Thank you. Next question here is, how do you encourage resilience in your children? Anyone is free to answer this. How do you encourage resilience?
Okay, so I'll go first. So resilience, first of all, is the ability to bounce back. I think that one of the first things that parents do around here is that they make failure look final. And so children are made to think, once I haven't gotten this, once I haven't achieved this, once I've failed, my life is over. People don't like me, people won't love me. Again, attributing whether or not you are accepted or validated to what it is that you can do. And so adversity will come. I mean, we pray, we hope, we desire that life is soft, but sometimes life can be hard. And so helping children understand that this is what life is. You know, I remember one day I went into a big store and a man walked up to me. I was with my children, they were, just playing around. And he said, "Madam, please, I need your help. I want to pick a toy for my son." And after we talked about it, I recommended. He said, "Are these your children?" I said, "Yes." He said, "How are you able to bring them into a store, into the toy aisle, and you're confident that, they won't ask for anything?" And I'm like, they can't. They simply can't. They know and understand and say to me, I mean, they're going to a store today, and my daughter said, "Mom, can I have this?" And she goes, "However, if you can't afford it, I will understand." We need to make life fair. A lot of parents feel like showing children that life is tough is too early and too difficult for them. It's about how you let them also see and understand. If there's a difficulty in the home, let them understand. When we were growing up, there were a couple of homes where parents wouldn't have school fees and would have to go around borrowing. A lot of those parents never wanted their children to know. And so when the children go to school, of course, they also feel like, come on, I've arrived. A school like this.
Yeah.
I remember a story, and I'll say it because it happened to my younger brother. One day my younger brother was going back to school, and my dad just called him and said, "I don't have money. Take this 5,000 naira." And my brother took it, said, "Thank you, Daddy," frustrated, and he went to school. And in another week or so, my dad was telling us that there was another family where the son had told them that, "Guys, I need 100K. If that money is not complete, I'm not going to school." And the child did not go to school until that money was complete. If the foundation is faulty, there's nothing that the righteous can do.
Yeah.
We need to lay foundations. Nobody has it all together. Nobody is perfect. But we need to compare notes. We need to read voraciously. I read a lot about parenting. I listen to webinars and seminars about parenting, and I ask parents to do the same. Challenge the parenting skills that you felt that your own parents failed at. But of course, be willing to do better. It's so easy to sit down and say, "Oh, my parent did not do this, my parent did not do this." And unfortunately, a lot of children are still sitting on those, mindsets that my parents failed me, and so because of that, that's why I'm a failure, that's why I'm rebelling and, doing things like substance abuse. Heal from your own trauma. They have their own lives. Their lives have, gone past. But with your own current life, what are you doing? So parents must be playing with children. Explain things to them in simple language. They will ask you questions. Answer their questions. When we were young, they didn't want to answer our questions. I remember one day my brother went to my dad. He said, "Dad, what's a condom?" And my brother was shocked. They didn't answer us, but we went to the dictionary to get out what it was. We probably did not understand what it was, but nobody answered. Answer your children's questions. Make them feel safe. Make your home safe. If the child does not feel that the home is safe, school is not safe, the child starts to have symptoms, physically unexplainable symptoms. If the child is being maltreated at home, and children are being maltreated even under the noses of parents who say that they put everything in place, any form of abuse, either physical, sexual, neglect, is more likely to happen with a family member as against a stranger. So speak to your children, be approachable, be their best friends, be their, their buddies. When they do well, encourage them. When they don't do as well, tell them that, well, you haven't done quite well, but I'm proud of you, and I will continue to give you all that you need to, to do well. I have a quite naughty daughter sometimes. So, sometimes she just likes to switch up. And so she did something one day and she be, yeah, she did something one day and I look at her. I'm like, I love you by force. And so for me, that's on the good days, on the bad days, I will show you love. I will discipline you when I have to, which is another thing parents need to do. She didn't say anything on that day. On the next day, she came to me, Mom, yesterday when you said you love me by force, what do you mean? And so you would see changes, you would see resistance, you would see children as they approach certain stages and ages of their lives come up with different things. But learn about children, read about it, read about the phase of development of your child, read about what to expect, read about the signs to look out for. So for instance, this parent asked us, be concerned, but don't be worried. But beyond that, do something with your concern. Ask for help, reach out for help, bring to a pediatrician, let a pediatrician see. And if a doctor says to you, this child needs to see a psychologist or a psychiatrist, they're not labeling your children. The earlier you get help for your children, the better. Teach children about stress. Teach them about how to manage stress in a healthy manner. Talking about it. Journaling, like you said. Listening to music. Painting. Drawing. Let them have creative outlets. And beyond social media, please, parents, let your children do things like play Ludo, Scrabble, Monopoly, those Rubik's Cubes. Play with different things. And learn how to be children again. Parents must also create time for children. It's difficult, it's tough, even for someone like me in a city like Lagos. But those memories are what your children will never forget. One of my fondest memories of my dad was my dad coming to school one day to pick me up. And I was on the swing under the rain. And he said, Bonju, let's go home. And I said, no, come and push me. And until my dad came into the rain to push me on the swing for just a few moments, I didn't go home. Create memories. Money is important, but money must never take the place of a parent's role in the children's life. All that, and we often say it to a child, LOVE, love, is spelled TIME. Spend time knowing your children. Thank you.
Thank you so much for this, because even just listening to you speak, I started to remember so many things from my childhood. Like how my mom would never try and make it seem like everything was always great, right? So look, if there are financial problems, I'll let you know, things aren't that easy right now, so that you can also build up a certain level of resilience to know that not everything is always going to be okay. But once when I was very young, goodness, I couldn't have been more than 7 or 8, and I literally just went to my mom like, Mom, what's sex? And she paused for a moment, and then I remember this woman literally took out her time to explain to me, to explain what safe sex is, to explain how you're not going to find out more till you get to a certain age, to explain the love aspect that comes into it. And that will forever stick with me. Because I could have said, Mom, what's sex? And she'd have been like, why are you asking that question? Okay, ask me that question again. Exactly. So it's very important. More questions have come in. We touched on this earlier, but we can touch on it again. Since mental health is very important to be left for the professionals alone, what role can the school or teacher play in improving mental health in children and teenagers, seeing as they spend more time in school and around their teachers and schoolmates? Floor is open again to anyone who would like to speak on this.
Sorry, I didn't quite get that.
The role basically that the school and teachers can play in improving mental health in teenagers and children if they spend most of their time there.
Well, I'm not an expert in regards to institution and in regards to schools and how they approach mental health. I wouldn't be able to say myself. I don't know much about how schools operate in that regard.
That's fair enough. Doctors, any advice here?
Okay, so there are school-based mental health programs that have been designed over time. And it's especially important because, like you said, children are like adults. Adults spend a third of their lives at the workplace. I feel like children spend a third of their lives in schools. I was speaking with the parents a few weeks ago, and she had said that once her kids leave for school at past 7, they don't get back to past 6 because they're. I'm like, no child. When does the child play? So the child do this when even though they had opted that the child should be allowed to leave way earlier. School is high pressure. School, I mean, we may not feel that way. When I was a child, I had a phobia for mathematics. And so every morning they come and they say it's mental health. Like I want to go to the bathroom. A lot of children struggle. And because of the environment that we're in that places such a premium on academic achievements at the detriment of many other things. So you have quite a number of children who are, academic flyers, they know this, they know that, but they can't form relationships. They can't build relationships. They can't cope under stress, which is where the concept of emotional intelligence starts to come in. And so for schools need to embrace school-based mental health programs. Those school-based mental health programs will focus on teachers, because of course, the teacher is a very instrumental part of a child's life, and on pupils as well. What we find nowadays, and it's something reflective of our environment, is that we're very reactive people. And so we wait until there's a problem and then we flash out. Oh, this happened in this school. It's until it hits the media and everybody's like, oh, they don't have mental health policies. Oh, what are they doing about mental health? So these things are supposed to be a part of the curriculum. And so at the PTA, there should be, specially designed programs for the school to talk about mental health issues. One, to the parents, that's where you can get some parents. Not all parents will come. To the teachers, and of course, for the children as well. The school is where many, and I say this because for many of the children who have been sexually abused, their best confidence is their teacher. What they can't tell their parents at home because the parents are not receptive, they go to school and tell their teacher, this is what is going on with me at home. And then the teacher is then able to, speak to the head of the school. They call the parents and then the parents get to find out. The teachers have to be in sound mind because they're also under a lot of pressure as well. I mean, they have their own lives and they will not drop that at the age just because they're coming in. Children must also be identified early. And so a child who comes to class and is sleeping, a child who comes to class and is crying, a child who comes to class and is bullying everyone else, we need to be able to pick up the signs early. But the umbrella term is that they are school-based mental health programs targeted at schools in the form of webinars, seminars, and interventions including the pediatrician, psychologists available, of course, from the village.
And I guess as well, like parents can also play a very proactive role to avoid that reactiveness that we just spoke about. If your child is in a school where these programs don't exist, etc., maybe you can also push for it, ask for it, and try and keep on going until the school listens and gets it. So the next question is, a 3-year-old boy does well at home, but refuses to do almost anything in school, such as talking, responding, and even taking his meals. As soon as he exits the school gate, his mood turns euphemic. That's not a word. That's a new one to my dictionary today, guys. Or even sometimes elated. He then gets home to recite all what he refused to answer while in school. He has had relatively delayed developmental milestones compared to his siblings, especially in terms of speech and motor development. What can you recommend, please?
Come in through the village to Kalong to see us. It's anxiety. I think that's the broad term I will give it until the child comes in. A child who feels safe at home. The home is a safe place, but the child does not see the school or perceive the school as a safe space. Either because the child has, so there are different types of anxiety. Separation anxiety, either the child doesn't want to leave, the confines of the home, or the child has some form of social anxiety, which shows up as performance. And so whenever the child is in a place where everyone or everything does not look very familiar, the child, starts to feel very negative vibes. So because we don't want that to, and it's already affecting this child, it's already causing some form of distress in the child. You're already being able to see 2 different personality types play out in this child, depending on where the child is. Let us intervene early. Let's find out what the possible issues, either with the child or at school are. Anxiety is one of the commonest mental health disorders in children and even in adults, if not properly identified. and managed, it may cause, a big issue. So please, let's help this child early.
So come into Palon through the village for any concerns to be addressed as soon as possible. We have a comment as well from Dr. Anya. She said, thank you, Olawale, Leila, Emanuela, and Bonju. This has been phenomenal. Thank you for keeping it real. So much I wish I knew when I was raising children. I'm glad my grandchildren's mum is listening. I suggest that we repeat this version of the village. I will publicize. Please read this message so it's not a question. Thank you, Mum. Next question, if you run a school or college, what departments can you open to counsel students?
So again, the mental health department, because people, run away from the name, once we're mental. We can, label or call it an emotional wellness department or an emotional wellness clinic. But clearly what we know is that it's going to cater to the psychological needs of individuals. For me, call it what it is. It's mental health, it's mental wellness, or it's mental resilience, or emotional wellness, whatever you feel comfortable with. But of course, at the end of the day, the purpose of establishing it should not be defeated.
Thank you. And we have one last question before we wrap this up. Okay, maybe it's 2 questions coming in. So I have a 4-year-old that has a lot of phobias. In trying to make him face some of his fears, we have to be firm. Right now, we're using the good cop, bad cop approach. Dad is firm and I pacify. How do we not cross the line between being firm to help him and harming his self-esteem? Secondly, Dr. Bonju mentioned how we're now raising autistic children. I wish he can throw more light on that because we were recently told by his teacher that he may be autistic.
Okay, so thank you very much. I'll start with the first question about how it is that the child has phobias. I have a phobia for water, and I'm afraid of the dark, even at my age.
I'm not alone. I sleep with the lights on.
What are you afraid of? What are you afraid of?
I don't know what I'm afraid of. I'm pretty much,
Okay, so
that afraid of things.
But I embrace it though.
you are
I
embrace.
well, I'm grateful, so I even
Well, and I
push myself.
I also like sorts too, so I am ready as well. And so you can see that even on this call, 3 out of 4 have a phobia. Phobias are natural. They're common to just about anyone. And for this couple, you need to be very careful about how you navigate this. The good cop, bad cop may not be the best, because what is beginning to happen is that the child is seeing that there's a break.
Yeah.
This person is bad to me, but I can always run to the arms of this person whenever. And so for the parents, you need to come together with a united front. Talk about it first of all. These are your phobias. Why are you afraid? Sometimes we create the phobias without necessarily knowing that we created the phobias for our kids. A child does something bad, and you believe that what you should do is lock the child in a dark room all by themselves. And then the child is crying, screaming, and you're not bringing them out. Those parents have created a phobia. Or you want your child to learn how to swim, and because all other children are doing the freestyle and the breaststroke, this your child, just throw them. It's one of the worst things you can ever do. If you did it to me, I would never swim again.
Yeah.
And so let's be sure that it wasn't the parent that even brought on these phobias. Number 2, the phobias are there already. You may not be able to deal effectively with the phobias if you don't understand the behavioral intervention that you need to do. And so there are certain things that the parents will need to be tutored on. You may read about them. However, I'm also thinking that part of what you've done is what you have read about. And so if you're not getting the results that you desire at this age, clearly because phobias again are a form of anxiety and they will affect the child's performance, please come and talk through the village at Palon to the professionals so that you can be easily tutored on how best it is to support this child. The good thing about children, and I'll tell this story because it's a very powerful story and very important. One day I went to my children's school, and a child just ran to me, and I carried the child. And immediately I said, "Can I see this child's teacher?" And so the next question I asked was, "Is this child able to sit still in class?" And they said, "No, that the child always wants someone to." And I said, "If it wouldn't be a problem, can I see the parents of this child?" Unlike most Nigerian parents that would have told you it's not your business, why are you prognosing? The mother came and told me that a significant life event is that 1, they just relocated from the UK. 2, she just had another baby. And so for that child, that was trauma. the fact that one other child was being preferred, that taking over a space. The child was not even speaking, and she was 3 years old already. And so I told the mother, I said, I'm not going to say that there's anything wrong with this child, but there's something happening to this child. Let's see how we can support. And so we did start to support, and she eventually took the child to, a speech therapist. One day, at the end of school, I was just going home and I saw the mother and the child, and I was like, hey, how are you? How is she? And the mother said, ask her. And I turned to the child, hello, how are you? And she said, I'm doing just fine. I had goosebumps all over my body. I was so happy, yet so proud. But that was done because there was early intervention.
Yes.
We need to pick out the signs early and intervene early. Parents, please. About raising autistic children, what are parenting practices these days that are not very involving and not very interactive? Let me ask all of us here, how many of us who have children sit at the dinner table with our children to have dinner? It's either one father is in the room watching TV and trying to turn in reports, the mother has eaten in the kitchen, and the children are left by themselves to sit at the table. We're losing those values that keep us close as family. How many families, if you are the kind of family that pray together, sit down and pray together, how many families read books together? In those days, my dad would call us and he would tell us stories about tortoises. I don't think that children even know anything about Japan or Yanni board. All of those things are things that bring us together as cohesive families. Apart from the PlayStation, Netflix, one day I bought Ludo and I said, no, it's because I want to develop the mind of my children. I said, let's play Ludo. They were like, no, after a while, they agreed. And then we started playing. And on the first day, my son won. The second day, he hadn't come out. All of us had come out and were already, and he started crying. Do you know that just because all of us are out does not mean that you still cannot win this game? He said, no, I can't win. I said, yes, you can. And for me, that was a lesson in resilience, because at the end of the day, he won. And so engaging children, taking them out, letting them play with sand. You know how we used to play with sand? Children these days, they are so excited when they see goats, because some of them have never seen a goat before. They're like, oh, I want to talk to the baby. I want to talk to the first. Take them to the beach, take them to a park, let them talk to you. One day I was taking my son to school and it was almost 8 o'clock. And I was trying to rush to get to school. My son said, Mom, I said, yes. He said, look at that purple flower. How many of us stopped to even observe that around us? Yeah, someone smelled the roses, see the beauty around us, was so engrossed, beauty of nature. Last time you went to the beach to, see the waves, feel the waves. We need to spend time engaging with our children. Come out of the house more. I understand that there are issues of security, but go to places that are secure. Do things that are not always screen, because another person now will say, oh, I'll take them to watch a movie. Well, that's not bad, but let's do things that encourage, play, that encourage learning how to manage and deal with other people. That's how we're going to be able to raise, children that are not autistic. However, if a teacher raises a concern that a child might be autistic, it might be because the teacher is seeing certain things, the child is not. And the 3 things we usually see in autism is impaired social interaction. The child is not able to, make eye contact, fix eye gaze, or repetitive play. And so the child, would rather play with their hands swirling around like this, or playing with a particular toy every day. The truth is, one symptom does not make for a diagnosis of autism. I remember one day I went out with my kids, went to a party, and it was an enclosed area, and the music was loud. And the next day, my son covered his ears and he started screaming. That's just hypersensitivity to sound. So it's one thing, but if they've raised a concern that perhaps the child may show some symptoms of autism, again, bring the child in. Let us assess early and let us give the support that we can to this child.
I also wanted to touch on something that she mentioned in her first point, which is, sometimes the children that are suffering from anxiety, it's passed down from parents unknowingly at times. And it was such a great example, especially the idea of being tossed into the water of the ocean. I have a personal example myself. Me personally, to be able to cut my hair, I always had a bad experience cutting my hair. And I found out later in life that the reason was when I was younger, the reason why I used to sit in the chair to cut my hair was my dad was always there. He was always there behind me saying, okay, I want them to cut it like this, cut it like this. And when I grew up, I kind of had this anxiety of being able to control that situation, but I had to develop past that. And I find that, okay, fine, okay, in children, it's going to be a journey for them to be able to identify, this is where my anxiety comes from, and I have to overcome it. But what who I work with is adults, and what I try to do is have a preemptive strike or preemptive strategy for adults to be aware not to pass on certain traumas and anxieties down to children. So, for example, what I do is that if an adult has anxiety and they come to us and say, look, I'm very anxious, I'm having problems, then I'm aware that this is an issue that could possibly, be spread to other people. I often tell the people that I work with that be careful of what you're afraid of. The things that you say, I'm afraid of this, be very wary of that, because sometimes it's not your fear. Fear is very contagious. For example, there are 4 people in this room right now. And if 3 of us should get up and start running or start panicking, then it's very likely he's gonna be panicking. What's going on? What's the problem? It's because our fear can spread to him unknowingly and increase anxiety. So one of the things I try to let adults know is discover the source of your anxiety first of all before you delve into the waters of panic. Ask yourself a couple of questions. Why am I anxious? One of the major questions I ask any adult when they come and say, look, I've been very anxious, it's been a very stressful day. First thing I ask them is, did you sleep well? Do you sleep well? Do you have a good sleep routine? Or are you like a night stalker? Do you stay up all night and then wake up at any point in time of the day? Because it's very hard to have a very straightforward, streamlined life if you have a very displaced routine in your schedule. Things will go awry and you won't be in control. There's something called a circadian rhythm by which people operate by, and that's the rhythm of our universe, basically being interlocked with that. Human beings, not all, but human beings are energized by the sun and are, to a certain degree, what they are is they're encouraged to fall asleep by the setting of the sun. When the sun sets, it actually it induces a hormone inside us that works with our pineal gland, and it encourages us to fall asleep. And then, of course, what happens to a lot of us adults is that technology is we look at our mobile phones all night, so it's giving us some kind of false lights. Yes. So often we're awake throughout the whole night, and we don't know why. But the reason is that sometimes we are the source of our own anxieties. We're not getting a lot of sleep. Secondly, I ask them, have you eaten breakfast? Now, for a lot of people, that's a very tough question because, first of all, in our blood system, insulin can actually take, if we haven't eaten, it can be filled with insulin. What I encourage people to do is eat a healthy, big breakfast, filled with proteins and fats. Just fill your body up and then see how you feel afterwards. See how you feel afterwards. You might feel anxious, you might come to work, say, I'm stressed, I'm unfriendly, I don't really want to engage with people. Have a good breakfast, one that fills you up, and just see how you feel afterwards. The next thing I ask a lot of adults is, do you have work? Do you have purposeful work that you are actually working, engaged in? Is there something that you direct yourself to that makes you feel purposeful, that makes you feel like I am trying to achieve something? And I find that this is where a lot of the issues whereby sometimes a lot of parents transfer some anxiety onto their children. When they have, lack of a better word, a bit of a scattered life and a directionless life, some of that anxiety, and you mentioned something that within all of us, even as adults, even in children, I'm not a father, I wouldn't know, I don't have children, but I am aware that even within children, I've observed that let me say in adults, we have monsters inside of us. When I say monsters, we can get irritable, we can lash out at our children. Our child can stop in the middle of a supermarket and start crying and screaming and embarrass us. And we look at that child like, when I get to my house, you're going to see what I will do to you. And that child will see that and realize that, this is not mom. This is not mom, because I know mom. This is so, and then it's that situation where it's like, if you can be honest to your child that, look, I can be a monster. I don't want to be, but it's inside of me. And you need to be aware that you can bring it out. I'll do my best to suppress it, but you must be aware that you can bring out the worst in me. It's within me. But thanks to you, I try to control it. Well, to a certain degree, that is a person that is saying that I'm not okay with how I am. I'm going to aim to always be better than I am. I always try to be on top of my game. And to me, that's in a way looking upwards, trying to achieve upwards for someone else, not just for yourself, but really becoming better for somebody else. And I find that that plays a lot into the idea of work, because for me, work is synonymous to sacrifice. Being able to sacrifice what you really want to do at a point in time for something better in the future. So what I often ask people is, do you work? Do you have a purpose? Something that you go to sacrifice your time so you can learn to give not only for yourself, but for other people, just for the betterment of a future that you haven't yet seen. And then I ask them, of course, do you have friends? Do you have relationships with people? Are you engaged with a relationship that is symbiotic, where you are respected, you feel respected, and you respect others? Therefore, you're not lashing out at people. You're not sending flares at people unknowingly. I find that children are very sensitive. I don't know, but my observation with, I just came from the UK, spent time with my nephew and niece, lovely kids, but they're very sensitive. They're very sensitive. They learn from us adults. And I often worry myself that, what are we teaching them? I mean, we educate them, but sometimes are we subconsciously passing on terrors, fears to their subconscious that they have to deal with on their own, which leads them to a sense of, later, because they don't understand it, a sense of nihilism, that nothing is really important. I don't think that I can't figure, like I said before, powerlessness. I can't figure out what my problem is, so I'm powerless to it. And the best thing to do is to just drink. The best thing to do is just smoke. The best thing to do is just inject myself. The best thing to do is take hard drugs. But they can find a way. And I think a major part of that is honesty from parents. I think that is healthy. I think speaking the truth. There's a psychologist, Carl Rogers, I believe. I think one of the propositions he puts forward is, if you speak the truth, it's healing. Because when you're speaking and when you're speaking, first of all, it heals you to get what is inside you. But once you know someone is actually listening to you, taking time to listen to your problems, that's a conversation. That's a conversation. And not only that, when people listen, then they ask the right questions. And that's why, I always advocate for therapy, because a therapist will sit down and listen to you, articulate, and most times they won't say anything, but subconsciously, you're going to find out, having a conversation with them, that I'm not okay with how I am now, and I can be better. They might not tell you how to be better, but somehow you might find out deep down that you actually know how to become better. And that's my perspective.
No, I think that's so important, and there's so much that we had touched on today and covered today. I think the most important thing is awareness that depression in children and teenagers exists, and it's not something that can be ignored. Getting the right help, having the right support is crucial in terms of how someone's life turns out. Nuclear is so important. There are so many takeaways from today, and I'm sure we could go on forever. Wish we could Thank you to everyone who has joined in. Before we go, doctors, Lawale as well, how can people reach out to you for your services? Obviously through Paylon as well. Please give all details and information.
Yeah, so like I said earlier, we're here at Paylon Memorial 24/7. So morning, afternoon, night, you can always reach out. It doesn't matter the time of the day. So we're here.
All right, so Dr. Manuela has spoken for us. All right, in addition, you can find me on social media, Instagram to be precise, at Dr. Bonjubola Abiri. Thank you.
Thank you very much.
And you can find me at Lighthouse Lekki on Instagram. And if you're looking for me in particular, I'm just Lawale Esho on Instagram. Lawale Esho with 2 E's, ESO, by the way.
Thank you. Thank you all so much. Thank you for sending questions in as well. There will definitely be another the village events, so Paylon will keep you posted on when and the timing for that. So we hope to see you all soon. Have a great day and enjoy the rest of your weekend. Thank you. Great.